Today we have Kathy Shats, legal specialist of the nutrition section of UNICEF headquarters based in New York. Thank you for your time with us, Kathy. We know that you have a very dynamic background in global health law and have spent a number of years advocating for stronger regulation of tobacco, alcohol, and unhealthy food. And now at UNICEF, you are leading the work related to the code, specifically on regulating marketing of breast milk substitutes, baby food, and related products. So my first question for you today is, given your background in tobacco control and regulation of unhealthy foods, you have identified the vectors of many chronic diseases are corporations that unethically market harmful products. The regulation of tobacco marketing has made much headway compared to marketing of breast milk substitutes or baby food. Though the products are different in nature, could you briefly identify the parallels that code advocates can use to mobilize code implementation, including country-level enforcement?
Thanks, Constance. That's a great question. Yeah, there's certainly a lot of parallels between tobacco control and formula milk marketing regulation. And one of the parallels that makes it a little bit easier is that both have an international legal instrument that states exactly which practices should be prohibited and how countries should go about doing that. So you don't have that, for example, with unhealthy foods or with alcohol. And so you end up having a lot of debates or disagreements about whether or how you should regulate it. But here, for both tobacco and formula milk, you've got the legal instruments, you've got the code, and they represent the agreement by member states. So although there can be some disagreements, on the whole, the evidence is there, and what we have to do is really clearly set out, which means the focus for our work for both of these areas is really advocacy to governments and helping governments pass strong legal measures. One of the key differences is tobacco control laws are a bit easier to communicate to the general public. They're more easily understood. So when a law prohibits indoor smoking, anyone in the space can see when a person lights up a cigarette or even, smell it after they've left, which really helps when you think about enforcing and when you think about governments being able to rely a little bit more on people to enforce the law. And similarly with tobacco marketing, if it's all prohibited, it's relatively easy for a consumer to identify examples of violations and even report them themselves. And so as a result, governments have been able to rely on consumer monitoring of violations in tobacco control to help enforce these laws. And that's something we can certainly aim for with formula milk marketing as people become more familiar with it. But right now, I think consumers on the whole are much less familiar with the code or any national laws they may have about formula milk marketing. And I think it's fair to say most people around the world wouldn't really be able to identify a code violation or really be aware of its existence even perhaps. And of course, another big difference is that it's now almost universally accepted that tobacco products are inherently harmful. They've got no benefits, they cause death and disease. So both the products themselves and the related marketing practices are harmful. Whereas with formula milk, the product itself isn't harmful. In fact, it's necessary for non-breastfed infants, whereas it's the marketing that causes the harm, which can be a lot more difficult to communicate to the public. And that in turn makes the law much more difficult to implement and enforce for now. Of course, you need to have education campaigns that come with it to raise awareness, but this is why tools like Catch are so important, because not only are they going to be able to help raise awareness for governments, but they're also going to be able to do a lot of that monitoring that in other areas like tobacco control, we've been able to rely on consumers, on people to do for themselves. And so I'm really excited about the tool because it's also going to plug that gap of consumer education. It's going to help people understand what violations look like and what they mean and how to keep an eye out for them themselves. So actually, I have a question for you. When you first showed me the tool, I mean, I was really impressed because it's so promising as a solution for one of the biggest obstacles the governments have in identifying, efforts to implement marketing laws, which is the monitoring piece. You've worked in this space for a really long time, so you've seen what works and what doesn't work well. for code monitoring of violations. So how did that experience impact which features of the tool and the website you decided to include?
As you know, I was the program manager of the International Code Documentation Center, also known as ICDC, which was a part of the IFAN network. So credit goes to the founder and the legal advisors of ICDC, and also the champions of the IFAN network. So compared to these champions, I have not been in this space for a very long time, but long enough for me to learn about code monitoring and really use ICDC as an overall reference for my current code-related work, specifically on monitoring. And thanks to Roger Matheson, Regional Director of Alive and Thrive East Asia Pacific, and also a part of the FHI Solutions Innovation Incubator for the catchy name, Catch, which stands for Corporate Accountability Tool and Communications Hub, and also a lot of the conceptual work that him and I brainstormed around. So I imagined it as a one-stop hub or platform with a focus on practicality. So we really wanted this to be a very practical tool. The functions of Catch are framed around the slogan, check, connect, and communicate. So for check, it centers around monitoring. So we wanted it to be a repository of live data on violations, and also a hub for code-related resources and documents. So people can actually go to one place to look at violations, to get a sense of the trends of violations, the companies that are violating, and also the supportive technical tools and documents and studies that are relevant to the code. So all in one place. And with the introduction of the AI technology, we also want the AI part to be a time-saving component. We train the machine to be able to shortlist large amounts of violations detected on digital platforms, and also to be able to identify what types of violations that are being detected. While we know that the companies are definitely the culprit, and that we need to hold them accountable for their practices, I also want to send the message out that social media platforms are also complicit in this health harming marketing practices. It's really interesting because I do have a very close friend of mine who is a marketing executive at one of the largest social media companies in the world. And I've spoken with her about this issue of BMS and baby food marketing on social media. And so her response is always, well, there's so many issues that the company's tackling. This is not the forefront of the many issues that they're tackling. I think what's not being said is that these kinds of marketing practices bring in money for social media platforms. And also, like you said earlier, that code-related issues, and specifically marketing of formula milk products, this is not something that the general public is very well versed in. So I do want to raise the awareness of this issue through this platform. The second part of the slogan is connect. So we don't want this platform to just be connecting with partners or with monitors virtually. We do want to have real collaborations and mutual support amongst partners, amongst monitors and health advocates. So we needed to identify links that are potentially most active on marketing breast milk substitutes. We actually consulted advocates or groups that are active in this code space. For example, from Australia, we consulted the Breastfeeding Advocacy Australia, an organization that advocates for the code. We also welcome national governments and NGOs to become partners to kind of share the load of this work, because training the machine and identifying and verifying violations actually can be quite time consuming as still. there's still a human element to train the machine to make it work better. For example, in Vietnam, we have built an AI tool to auto-detect violations on digital platforms within the national context. It's based on the national law of Vietnam. And our Vietnam office has also been working very closely with the government of Vietnam to identify and verify the violations. So it becomes like a shared responsibility. So we want to connect with different groups and organizations and agencies and governments in that way. And finally, communicate. So we know that a bunch of raw data can only go so far. So raw data has to be processed and analyzed for it to be really useful. We will continue to develop spin-off or sort of like premium products to address different target audience, from slightly different angles. For example, we will be developing newsletters based on the analysis, of the raw data to target policymakers, NGOs, and health advocates. We will also be developing reports and briefs to inform folks and companies that are committed in ethical investments about how these companies are doing, the fact that these companies are committing in practices that are harming the health and lives of babies to inform their investment decisions, and also to provide evidence and database for research and policy briefs as well.
Wow, that's amazing.